Hi everyone. I don't think this video will interest too many people because I'm going to talk about an extreme topic. But I must say, it is worth mentioning. The leg slimming procedure. Where did this idea come from? When I started working on leg restoration surgery by inserting a leg prosthesis in the early 2000s, I encountered many different cases. We do calf augmentation. We've been applying augmentation and restoration procedures using prostheses on patients who have the so-called spindle shanks deformity. Then different cases started to arrive. Ladies complaining about thick legs started calling us. The common complaint was this, very interesting. They tell me, I went to buy boots in the beginning of winter, my feet fit well inside the boot, but I can't close the zipper. They were saying their calves were rather plump. When so many patients started to call me with such a complaint, I started to do research on this topic. How could we slim the calves? I'll go over it very quickly. There are different methods. Different techniques are applied across the world for this purpose. Botox injection, calf reduction by radiofrequency. Also, calf reduction by removing the calf muscle, so sacrificing much muscle mass. As such, there are many different techniques, but in my opinion, none of these techniques provide a reasonable and a pleasant result. Take Botox, for example. Well, posterior to the knee, they apply Botox to the nerves that innervate the muscle. In related articles, I saw photos. While one side of the leg gets thinner, the other side remains thick. There are crowns on the leg. The patient's calf looks like a potato field. So, as far as I understand, Botox does not provide a homogeneous reduction. I also researched radiofrequency devices and talked to an experienced electrical engineer responsible for importing such devices. He allowed me to examine the probe and said, it would not lead to much reduction in the muscle volume and that I would have to use it many times. He also said the probes are very expensive. He said the procedure would be very costly as the probe was discarded after being used on the patient. Well, I researched the subject in the literature and could not find an article claiming that the procedure was effective. Then, another technique applied for calf reduction is liposuction. I think this is a very wrong method. To put it plainly, applying liposuction below the knee is dangerous. There are significant subcutaneous nerves in this area. If these nerves are injured, the patient will start to limp visibly. I do not recommend applying liposuction below the knee, in particular the ankle. Years ago, I was invited as a guest to a TV program that discussed health issues. The woman on the show was limping. She was wearing an ankle foot orthosis, walking around with a splint. Wishing her to get well soon, I asked what happened. She said 2 years ago she had invited a plastic surgeon to the program. She then contacted him to have her ankle slimmed and he applied liposuction to her ankle. The reason why she limped was a damage to a nerve in her ankle. She said she was undergoing physical therapy and using splints. She had also sued the surgeon. So I think it's very dangerous. The amount of fat that will accumulate on the ankle is not suitable for reduction by liposuction. So I think it's just useless. And then there is another technique that yields similar results. That's removing the gastrocnemicus muscles in the posterior region of the calf. It sounds like a brutal method, doesn't it? There are already 3 muscles in the posterior region of the calf, and they totally remove 2 of these. I was also shocked when I read about this procedure in the articles. The whole muscle mass is removed from the posterior region of the knee, and the muscle is standing outside. They cut it from the bottom. The articles say, keeping only the soleus muscle will be enough. The patient can walk, even run without problems. But there is one issue. The posterior of the calf becomes so flat and thin that the patient is directly confronted with the spindle shanks issue. In my opinion, it is not a reasonable procedure and sacrifices a large mass of tissue. I think it is also against the logic of plastic surgery. I don't think it's a right decision to completely sacrifice such a huge, healthy tissue just to correct the appearance, to slim the calf. So I sent an email to the surgeons who wrote these articles. The articles submitted for publication in those years were queued to be published maybe 3 years later. For example, an article submitted for publication in 2000 and accepted to a journal would be published only in 2003. Therefore, I asked these surgeons whether they still use the same technique. Were they really sacrificing all the muscle? In the emails, I stated that I had read their articles and I had been interested in calf reduction. I asked them whether they still used the same technique. Were they really sacrificing the entire muscle? I stated that my idea was to remove only a part of this muscle. In their reply, they told me that they were still using the same technique. These surgeons open up the posterior of the knee and make a short incision behind the ankle for this procedure. They remove the entire muscle by cutting both the top and the bottom. Alternatively, I explained my plan was as follows. I would make an incision just on the posterior of the knee and I would remove some of the muscle tissue, not more than the size of the prostheses placed in calf augmentation procedure. So from the medial part of the gastrocnemicus muscle. They replied me saying that they were following the same technique, making 2 incisions behind the knee and the ankle and removing the entire muscle. I expressed my opinion, arguing that this technique should be taken one step further. If our aim is to reduce the calf muscle, in order to slim an overdeveloped muscle, it should be sufficient to remove some of the muscle from the middle, equal to the size of a prosthesis, just like placing a prosthesis in the middle to augment an underdeveloped muscle. This was what I had planned. I did not plan to make an incision from behind the ankle. This is my solution, which I offer to my applying patients. We can perform this kind of surgery, but it's not something that's been done before. In other words, I cannot predict how long the surgery will take and what kind of problems we may encounter. Then one day, a patient of mine who was working as an ambulance nurse was convinced for this operation. She gave us a signed consent to accept the operation. She signed the consent form saying, I know that I am the first patient undergoing the surgery. I accepted taking into account any possible complications. So we performed the surgery on a Sunday, just because I couldn't know how long the operation would take. We wanted no case following our operation. It could have taken much longer than planned. We started the operation with an incision posterior to the knee. During the surgery, I tried to peel off the muscle, but the fibers of the gastrocnemicus muscle were simply incredibly tough. Unbelievable. Surgical scissors didn't work. Neither the scalpel nor the scissors worked. We simply couldn't cut it. I opened most of the surgical sets in the hospital. We tried dozens of surgical scissors. In the end, we were able to separate muscle fiber equivalent to the size of a prosthesis from the middle part of the muscle using some of the scissors. However, we couldn't cut the lower end. So, at that point, I understood why the Taiwanese surgeons made an incision behind the ankle. Removing a piece of this muscle without making an incision was impossible. Incision behind the ankle was a must. Therefore, we also made an incision from behind the ankle for this patient. We couldn't cut the lower end of the muscle that we wanted to remove. Well, we took it out. I looked inside the operation site with the endoscope. We removed a large piece of muscle and got the result I wanted, but inside there were large veins. There are important, thick veins inside the calf muscle. It turned out to be very hard removing the calf badge without causing bleeding in those veins. To be frank, I thought like this. I removed the size of the muscle tissue that I wanted, yes, but when I saw those veins, I remembered the other calf. To achieve symmetry, we had to remove the same amount of muscle from the other leg. A second operation was necessary. When I saw the veins inside, I felt really miserable. Anyway, I operated the other leg similarly. I managed to remove just as much muscle tissue as I wanted, equivalent to a prosthesis without causing any bleeding. But the operation took about 6 hours. When I completed the operation, the color of the surgical gown I was wearing had completely changed due to sweat. There was no spot left that wasn't wet with sweat. And we were able to reduce the patient's calf circumference from 42 to 32 centimeters. We measured the calf from a certain point, and after the operation, we wrapped the patient's calf from the toe to the knee. I examined the patient regularly after the surgery, and at the post-operative examination, we had 32 centimeters. The result was extremely successful. The calf circumference dropped by 10 centimeters. 32 centimeters is a perfectly normal size. In other words, the calf circumference was reduced to normal. Most importantly, the shape of the leg was not distorted. If we had removed the muscle completely, just as the Taiwanese suggested, we would end up with chopstick-like straight legs with no fullness. However, we managed to reduce the calf circumference while preserving its fullness. We achieved an extremely successful result. I had searched the literature and even wrote to the forums where plastic surgeons exchanged views, asking if anyone had performed such an operation. As far as I know, that patient was the only such case in the world. This lady was the only patient who underwent a correct calf reduction surgery. The result was extremely successful, but there is only one single problem. This surgery is not a routine operation. When I came out of that surgery, I swore that I would not do it again. It was an extremely difficult operation. It was incredibly difficult to cut through such a hard muscle and to separate and dissect the muscle mass as much as the size of a prosthesis. That was very difficult. In addition, there are really thick veins inside the muscle tissue. Venous blood vessels. The walls of these vessels are weak. They can bleed at the slightest intervention. So only God knows how we finalized this operation without causing any bleeding or hematoma. But in the end, the surgery was very successful. The lady was a very lucky patient, I think. We had a very successful result. We did not create any problems, and she is the only patient in the world. I think there is no other case where the calf diameter was reduced from 42 to 32 centimeters without deteriorating the leg form. No other case exists. I even wrote to the forums of plastic surgeons. No one else had performed such an operation. Someone misunderstood me and sent me a lymphedema case. It was a patient whose leg was enlarged due to this situation. They slimmed the leg by liposuction. They removed the lymph tissue. But that's not the same thing. My patient did not have any extra health problems. She only contacted me because of excessive muscle mass. We reduced the muscle mass by the size of a prosthesis. We retained the rest of the muscle and were able to slim the leg without losing its form. The result was extremely successful. But like I said before, it's not a routine case. Later, I had several patients who called me requesting a calf reduction. I told them I had performed one but swore not to undertake another. It's a very difficult operation. Money is not the issue. I told them I would never perform such an operation again, no matter how much money you offer. I had to talk about this because I think it's a surgery worth mentioning. There are dozens of methods for calf reduction, as I said. Buttocks, radiofrequency, liposuction, etc., but none of them works. I wouldn't recommend any of them. We got a successful result with the surgery, but frankly, I wouldn't recommend it either. As I said before, it's an extremely hard surgery. There may be risks of injuring veins, bleeding, hematoma. In other words, it is a high-risk surgery. So I did perform one experimental operation. The result was very successful. But as I've said, only one patient. So I wanted to mention it here. It was necessary to talk about it, to write an article about it. If I were at the university, I would definitely have written and sent an article about that case, a real key spot, a special case. But I've rather chosen to talk about it here because I don't intend to pursue an academic career. I'm not currently at the university. So thank you for watching. See you on the next video. Goodbye.